we've got to go by CPT rules, but the insurance companies don't. And that's why the Academy on the national level has really been fighting for us for 20, 25 years. There was a time when the Academy could not talk about the business of medicine. I know in my state, usually it would be the president of the chapter and some other people had formed a separate group in our state to try to discuss with the insurance companies. We couldn't do it through the AEP. And that fortunately changed for us probably late 80s, early 90s. And that's where you've got SOPM, which is the business arm of the Academy. We had PAT, which actually can talk to the insurance companies about problems that you in Long Island are having, or someone in Des Moines, Iowa is having. We have the hassle factor for, which hopefully everyone knows about. You're having a problem with a company, fill it out, send it in to the Academy, and someone from the Academy will take care of it. In the old days, if you complained to an insurance company, oh, you know what, I'm having an issue with this code, and they would say, Randy, you're the only one.
Yeah.
But now, if you can show them 100, 200, 500 people around the country, they can't say that anymore. So to me, the Academy has really worked hard to help us. Coding is a pain. Unfortunately, I've got my own consulting business, and it's still going all these years because a lot of our colleagues still don't know how to code properly, don't know how to document their notes properly. And when they're audited, they're getting nailed, and insurance companies are saying, all right, you made a mistake here and there. So we think of your 10,99214, so you made a mistake. All right, please, you owe us $100,000 back because we downcoded you. It's terrible. Codes change every year, the CPT codes as well as the ICD-10 codes. But come on, there are people, George, who still don't understand the basics. If a kid came in for a flu vaccine, besides billing for the vaccine and the vaccine administration code, they're putting it in office visit when they didn't do anything. And they want to know, why am I in trouble? So you need to know, you need to have the code, and the state chapters, national, all have new codes are always coming out. You need to know how to use them properly. And you mentioned behavioral healthcare and care coordination. People will be shocked how many codes there are into care coordination and chronic care management. You have to know about them. You have to know the differences between each code. But there's so many, and so many where it doesn't have to be the doctor who's doing the work. It could be someone else in your office who's qualified to do it.
So let me dig a little deeper to that, because you said a lot of things. And I wish it was as easy as you're describing to do these things. First, there's a big, steep learning curve because these codes keep getting generated. I don't know how many codes are into CPT today and makes, but there is hundreds, if not millions of codes, which makes it a challenge to keep up, even if you listen to your talks and you read and you try to stay up to date. Then there's they don't make it easy. So the care coordination codes, an office staff member, the secretary, the front desk person can do the care coordination. Doesn't have to be any kind of license. And there's 3 types. There is one for when the physician does it, one for when the physician does it and the patient only has one chronic disease, one for when the physician does it and there's 2 chronic diseases, one for when the staff does it and there's 1 chronic disease versus 2 chronic diseases, and those are in 20-minute incremental steps, but they're to build only once a month. So just the record keeping of my care coordinator is reaching out to George's son about his asthma, making sure that he's taking the inhalers properly, notes it in the chart. He has to put it down somewhere, and at the end of the month, make sure that goes to the biller so it gets charged. That doesn't make it easy. Then you have to go into each state's different Medicaid web portal and figure out how they're playing the system. So in Virginia, they have a wonderful program started by Sandy Chung, where I can call a pediatric psychiatrist through VMAP any day of the week for a kid that I am at a loss to what to do with their mental illness. And they're very good. They'll call you within a couple hours. Virginia Medicaid has decided that because I'm doing the care coordination, talking to that psychiatrist who's on a grant, so he's not getting, or she's not getting paid through insurance, it's a grant for their time. For that time, that hour I spent presenting the case, going over the case with a psychiatrist on the phone, trying to coordinate care for this patient, Virginia Medicaid says that work is worth zero. It's not uploaded, so nobody will pay for it.